Diabetes cases to rise sharply. Washington. Even if obesity rates remain stable, diabetes rates will double worldwide by 2030 to 366 million people getting the disease, a team of international researchers has found. The total number of people with diabetes is projected to rise from 171 million in 2000 to 366 million in 2030. The team has written
the regular mainstream medical world has not been able to give solution to these problems. Whether it's diabetes, hypertension, heart problem, epilepsy, once a diabetic, ever a diabetic. Once an asthmatic, ever an asthmatic. Therefore, what is the way out? No? So they are looking for alternative systems, traditional systems or complementary systems. All these things are very sophisticated problems. They are not single dimension like an accident or a pregnancy or others. No? Therefore, you need a multidimensional answer. Physical, mental, emotional, intellectual, all that. And that's what yoga provides.
Yoga allows us to bring an expanded consciousness of loving, living, and healing to our everyday activities, starting from the inside out. A rainbow of practices was developed to help us make that journey. Included in that rainbow is the knowledge that we are healers. This decreases the need for someone else to fix us. We learn more about our bodies and minds than anyone else. We then consult with professionals as partners in our healing process, not as fixers. The Swami Vivekananda Yoga Research Foundation, or Vyasa, located near Bangalore in South India, has been using yoga as therapy for the last 27 years to treat hundreds of thousands of people from all over the world. Vyasa attempts to cure common ailments like back pain and neck pain, as well as life-threatening illnesses like diabetes and cancer.
Since last 10 years, health is not in a good position. I was suffering earlier from the diabetes, and afterwards this hypertension, blood pressure also increased. So then I was taking the allopathic treatment for this, and diabetes was remaining about 200. Sometimes it was going to 50 also. When I came here, my blood sugar was checked, it was 210 and blood pressure was 119. Now it is checked yesterday, in 5 days only it is reduced drastically, and now my diabetes level is 146 and blood pressure is 110, 115 only. Medicine also, whatever the medicine I am taking, about 50% medicine is reduced.
Diabetes is caused because of the inability of the pancreas to produce sufficient insulin. It is mostly genetic. But today, diabetes is recognized more as a lifestyle-related disorder. Modern life, with its tension, erratic eating habits, and high cholesterol diet, leads to stress and obesity, which in turn cause diabetes. What is the solution?
Moderation in food, moderation in sleep, moderation in activity, moderation in thinking, moderation in worrying. So everything in moderation is the ideal law for a healthy living, says Bhagavad Gita. So this is what lifestyle change is all about.
The modern lifestyle demands speed and aggression. Thus, a moderation in our reactions and in our response to demanding situations goes a long way in coping with diabetes.
Yoga is a wonderful tool for bringing about this lifestyle change as a whole. So what we try to do in yoga is teach asanas to balance and bring about weight reduction. So dynamic yoga practices for burning out the calories. And then we have slow asanas to bring about very deep rest to the pancreas by bringing a lot of blood flow to the pancreas and through that help the pancreas to rejuvenate.
The breath is the bridge between the body and the mind. The pattern of breath also directly affects the mind. Breathing practices control stress, help in coping with diabetes. Finally, mind management through meditation and awareness of one's situation helps calm the mind.
Convincing people to do this practice is never easy because most people don't believe in it. They believe in the Western medical model. They believe if there's a heart problem, you cut it and you reconnect it. It's very much like a plumber. And I really gave up on trying to convince people because if something has lasted for 5,000 years, it's not a fad anymore. And that's what I say to them. Don't you think that something that lasted that long has to have something to it?
Yoga as therapy for diabetes. Sit in any comfortable posture. Say a small prayer or just remain quiet for a minute or two. Enjoy the silence. Hold your right wrist with your left hand. Bend forward and touch your head to the floor. Dorsal or back stretch. Lie down on your back. Take your hands above your head. Inhale, raising your head, shoulders and body up to the back, arms parallel to the ground. Hold this position for a while. Exhale, come down and relax. Repeat the same movements 5 times. Dorsal stretch activates the abdominal muscles and reduces abdominal fat. Come back to starting position. Relax. Jogging. This is done in 4 stages. Stand straight with your arms by your side. Slow jogging. Start jogging slowly on your toes. Gradually increase the speed according to your capacity and slow down the speed within 20 counts. Continue slow jogging. Backward jogging. Lean forward a little and start hitting your buttocks with your heels. Increase the speed of jogging gradually. Do this for about 20 rounds as fast as you can. Gradually slow down the speed, but do not stop in the middle of the practice. You are now back to slow jogging. Forward jogging. Lean backward a little and raise your knees almost to the level of your chest. As you increase the speed again, try to raise your knees higher and higher. Continue for about 20 rounds, as fast as you can go. and come back to slow jogging. Side jogging. While jogging, bring your heels by the side of your buttocks. Increase speed, bringing your heels as close to your elbows as possible. Continue this movement for 20 rounds as fast as you can. Then gradually slow down till you come back to slow jogging. Come back to starting position and relax. Forward and backward bending. Stand straight with your arms by your side in Tadasana. Stretch your arms straight above your head, palms facing forward. Inhale, bending backward with your arms over your head, and exhale, bending forward. Bring your arms down as much as possible. Start slowly and gradually increase the speed within your limits. Do this 20 times. Similarly, gradually slow down before stopping the practice. You can also stand with your legs apart, allowing your arms to move freely between your legs. Then, while inhaling, come up and bend backward, and exhale and bend forward. Do this 20 times. Ardha Matsyendrasana or half twist posture. Sit in Dandasana or stick pose. Bend your right leg at the knee along the ground and place your heel about 4 to 5 inches away from your groin. Place your left foot by the side of your right thigh near the knee on the outer side. Bring your right hand around the outer side of your left knee, passing between your chest and your knee, and hold your left big toe. Your right shoulder blade rests on the outer side of your left knee. Take your left hand around the back and try to touch your right thigh. Look back over your left shoulder. The erect knee acts as a fulcrum for getting maximum twist of the spine. And keep your body straight. Do not sit on your heels. Hold on to this position for about a minute. Come back to starting position. Repeat the same on the other side. Bend your left leg at the knee along the ground and place your heel about 4 to 5 inches away from your groin. Place your right foot by the side of your left thigh near your knee on the outer side. Bring your left hand around the outer side of your right knee, passing between your chest and your knee, and hold your right big toe. Take your right hand around the back and try to touch your left thigh. Look back over your right shoulder. Hold on to this position for about a minute. Come back to starting position. Relax. Dhanurasana or bow pose. Lie down on your abdomen with your legs together, hands stretched out in front of you. Bend your knees and hold your ankles with your hands. Your toes should be together. Inhale, raising your head, chest and legs so that the spine is arched backward like a bow. Rest on your abdomen. Do not bend your elbows. Look up. Initially, your knees may spread out, but with practice they can be brought close. Hold on to this position for about half a minute. Breathe normally. Dhanurasana activates pancreatic cells. Slowly come back to starting position. Now relax in Makarasana or fish pose. Now allow your head to relax onto your folded arms so that your neck is supported at the point where your two arms cross. Sarvangasana or stand on shoulder posture. Lie down on your back. Take your hands above your head. Raise your legs together very slowly and gracefully without bending at the knees till they are at about 90 degrees to the ground. Place your arms near your buttocks. Now raise your buttocks and trunk using your arms and elbows as support without lifting your head. Rest your elbows on the ground firmly and support your back with both your palms. Straighten your trunk with your hands till your chin rests on your chest. Your legs should be straight. Keep your body erect, stretching it up vertically, supported on the shoulders but relaxed. Carefully avoid all jerks and keep your head on the ground. Hold on to this position for about 2 minutes. Come back to starting position. And relax. Matsyasana or fish pose. Lie down on your back. Take your hands above your head. Place your right leg on your left thigh. Place your left leg over your right leg on the right thigh. Place your hands on either side of your head with your fingers facing towards your shoulders. Using your palms as support, lift your head and back off the ground. Slowly bring your head to the ground by arching your spine backwards. Remove your hands after you've balanced your weight on your head. Catch hold of your big toes, locking your index fingers around them. Hold on to this position for about 1 minute. Slowly come back to starting position. Uddiyana Bandha. Stand straight with your arms by your side in Tadasana. Spread your legs 2 to 3 feet apart, bending forward slightly from the waist, and place your palms on your thighs, keeping your arms straight. Make yourself comfortable in this position. Exhale completely by vigorously contracting your abdominal muscles. Hold on to this position for as long as comfortable. And while inhaling, slowly release your abdominal muscles. You can repeat this a few times. Come back to starting position and relax. Nadanusandhana. This is a meditation technique that reduces the levels of stress and gives a deep internal massage to your body. Sit in any meditative posture. You could sit in Vajrasana, otherwise, you could always sit in Sukhasana. Or you could sit in Siddhasana. Or you could sit in Padmasana. Now close your eyes and feel completely relaxed. First stage is with Akara chanting. Touch the tips of your thumbs with the tips of your forefingers as in Chinna Mudra. Inhale slowly and fill up your lungs with your breath. Exhale, chanting Akara in a low voice. Do this 9 times. Feel the resonance in your abdomen and lower part of your body. The second stage is with Ukara chanting. Touch the tips of your thumbs with the tips of your forefingers, folding your middle, ring and little fingers as in Chinmaya Mudra. Inhale slowly and exhale, chanting Ukara in a low voice. Feel the resonance in your chest and middle part of your body. Do this 9 times. The third stage is with Makara chanting. Inhale slowly. Make a fist of your palms, keeping your thumb tucked inside, as in Adi Mudra. Exhale, chanting Makara in a low voice. Feel the resonance in your head region. Do this 9 times. Focus on all the changes happening inside your body. Completely relax and enjoy the feeling.